I just want to check if there is a surge in cases after the holidays, what conditions or elements would prompt you to consider further restrictions or extensions? And do you have a difference in priority of extensions versus restrictions?
Yeah. I hadn't really thought about it. We try and keep all of the options open, but clearly we're watching what's happening, not only here, but what's happening around the world. And, people in British Columbia are doing the right thing, and that has made all the difference for us. And we are seeing a decrease. Obviously, I've been concerned about the holiday season, about people coming together. Many small groups of people coming together leads to lots of transmission, unfortunately. And we're starting to see that. So it will depend on what we're seeing over the next little while. But we have leveled off at a number of cases that is still very concerning. We know that this virus can take off quickly. So we will be looking at where are the situations that we're seeing transmission, what is the impact of what has happened last weekend, and of course tonight and going into this weekend. So those are critical things. This is why we've put in the extra restrictions for tonight. We want to make it clear that we need, in this global pandemic where things are getting worse all around us, we need to pay attention to that. We need to keep doing what we're doing because we're on the right trajectory. We don't want to blow it now.
Follow-up, Craig?
Yes, thanks. I was just wondering, is there a maximum threshold for which contact tracing can operate in BC? And if we reach that point, would you call off contact tracing, or would you have it continue on for information purposes? Because the reason I'm asking is a representative from Toronto Public Health was saying on the news that because contact tracing was called off, they didn't know where outbreaks or clusters were happening. So I was just curious what BC's approach would be.
Well, we recognize that this virus is one that is amenable to those types of public health actions like contact tracing, and that it is a key part of how we can control or at least understand where the virus is spreading, and that helps us take the measures that we need to take to control it. So very early on, we put resources into contact tracing, and as Minister Dix reported, we've hired thousands of people to support our contact tracing, and we started that in the summer when our rates were very, very low, and that has helped us. We have come up against the edge of us being able to do that effectively, particularly in Fraser Health a couple of weeks ago, and in the north. And we are rearranging and supporting as a system in our public health system how we can support those areas when we have surges in different parts of the province. And the BC CDC has set up a contact tracing node that we can support, but there are limits to what we can do. So we are focusing, particularly in the north and in Fraser Health, we focused on the key high-risk environments. We've put together the school team that I talked about, as well as a workplace health team, because as we're seeing across the country, and we see here periodically as well, we do get quite large outbreaks in different workplaces, whether it's poultry processing, whether it's Canada Post or Amazon sorting centers, or whether it's related to the ski resorts. So we have been focusing on trying to identify those types of situations where it can spread widely to larger numbers of people, both in workplaces, in school settings, in healthcare, of course. And part of why we put in the restrictions on events that we have is because we were seeing so many clusters and cases related to private gatherings and social gatherings. So those social gatherings were what tipped us over the edge a few weeks ago, months ago now, I guess. So those are the things that we're looking at. So for us, we have put a lot of effort and time and resources into maintaining our contact tracing, and we have not yet been overwhelmed, but we have been on the edge a few times and are taking measures to make sure that we can support each other around the province. And we all need to do our bit, because we don't want to be in that position, because that makes it so much more challenging to curb transmission.
Just one or two additional things about where we stand. As I say, 1,297 people have been hired. A further 76 positions have been made available and will be hired by the First Nations health authorities. We received support from 70 FTEs from Statistics Canada in terms of our contact tracing. We also have 362 people at the interview stage and 123 candidates in addition to that at the offer stage. What we're looking at right now, because there are a significant number of candidates in the pipeline, is whether those new positions will be accessed for continued contact tracing work or if there are other opportunities. And of course, we want to also be in a position to address attrition. But 11,189 people across BC expressed interest either directly to health authorities or to Health Match BC in being involved in contact tracing. And just to put this in context further, in Fraser Health, they've hired 603 contact tracers to date. There's a further 111 in the interview stage, and we've deployed 28 additional contractor tracers redeployed to Fraser Health from the PHSA, from their rapid response pool. So we continue to be, from all perspectives, very interested and very engaged in the strategy in BC, and other provinces have had different circumstances and different views on this, but we're very committed to this idea, and we're going to continue to provide resources in support of it.